Bismillahirrahmanirrahim. Assessment. In the assessment part of the SOAP notes, the doctor or the physical therapist he will work on three main domains. These three domains consist of number one, the diagnosis, number two, the long-term goals and short-term goals. The diagnoses are also called as the problem list. The therapist will make a problem list from the subjective and objective notes of the SOAP notes. For example, the therapist noted in the subjective part of the notes that the patient is having a raised pain of 7/10 on visual analog scale. So now he will write that upon his paper in the assessment part under the heading of the problems list or diagnosis. Number one is the raised pain of visual analog scale. VS is equal to 7/10 in the right shoulder region. Secondly, he will also see that is there any other problem existed in the subjective part. If not, the therapist or the doctor now comes to hold the subjective note. In the subjective note, we saw that there was a problem that the active range of motion of the patient is decreased. So the therapist will write this diagnosis as a decreased active range of motion of the shoulder joint. Flexion is equal to 80/180. If there is abduction, he will write also abduction, internal rotation, external rotation. All the movements will have been, their range of motion will have been checked in the objective part, and now it will just be written as in the problems list. Third problem, just he saw that the patient anterior deltoid or the whole musculature of the shoulder is weaker as compared to the normal shoulder. So he will write as decreased in strength of the right shoulder musculature of grade 4/5. So this will be a problems list. A problems list could also contain shortening of a muscle, raised pain, decrease in the active range of motion, any dependency has been increased, the patient cannot transfer from bed to chair. So this will be included in the problem list. And in the next part, the doctor is going to make the goals. First of all, he will make the long-term goals. The long-term goals will be based upon the problems list or the diagnosis of the patient. For example, the first problem is that there is increased pain in the right shoulder of visual analog scale of 7/10. So similarly, in the first long-term goal of the patient will be to decrease. There is raise, and he will now decrease the pain in the right shoulder from visual analog scale 7/10 to 0/10 or 3/10. Any type of goal he can make, but he will now here mention the duration in how much time the therapist is going to decrease this pain, and he will be working on that. For example, he is thinks that the pain will be decreased in 1 month or in for 20 sessions. So this will be written along the long-term. First, now long-term goal. Secondly, we see that the second problem is the decrease in the active range of motion. So the second goal is increase in the active range of motion of the patient shoulder movement from 80 to normal range within 2 months. So this will become a long-term goal. So all these long-term goals are to be made in this way. Then the therapist will form some short-term goals, because the long-term goals are to be achieved in the later stage, but the roadmap and the way how they will be achieved, this will be done through the short-term goals. So the therapist will be also make the short-term goals, and like the first short-term goal will be to decrease the pain in the right shoulder from VAS is equal to 7/10 to 3/10 or 4/10 in 4 sessions or 5 sessions. So this will be a short-term goal, and the therapist, when he will execute his plan of treatment, then he will, after 4 sessions, he will reassess his patient that if the short-term goal is achieved or not achieved. Then he will formulate another short-term goal if the first goal is not achieved. And in the same case, the short-term goals for the loss or decrease of the active range of motion and for the loss of strength of the shoulder musculature, or any impairment in weakness in transfer activities of the patient in ambulation, and any problem, these will be discussed, and these will be brought under the short-term and the long-term goals. And all this process is called as assessment of the patient. When the assessment is completed, the doctor now will move towards the plan of the treatment, which will be discussed in the next part, inshallah. Thank you so much. If it is useful information for you, and you find it supportive for yourself and others, please like and share this, and also subscribe to my channel. Thank you so much.